Welcome back to Health in Today's Woman. Today we are joined by the staff from Middle Tennessee Medical Center in Murfreesboro's Wellness Center. I am very blessed to be joined by Andrea Hutton and Ann Garner Sutton. Is that correct? Sanders, sorry. And today we're talking about wellness. In the first segment, we really talked about wellness. In this segment, we want to talk about patients who are removing from a disease or recovering from a disease and are starting to do things through the program to help return to wellness. So Andrea is in charge. Andrea Hutton is the senior exercise physiologist, and she is in charge or works with the cardiac rehab program at the Wellness Center. So I want to start off with you talking a little bit about what this program is about. What exactly is a cardiac rehab program?
That's a good question. Most people don't know that. Cardiac rehab is a rehabilitation program for anybody who has had a heart attack, had bypass surgery, has had a stent placement, angioplasty. What we do is we hook them up to a heart monitor. We give them a specific exercise program given their needs, given their time out from their surgery, and we watch them exercise, and we look for any types of signs or symptoms, anything that's abnormal for them, whether it's the heart rate's abnormal, the blood pressure's abnormal, the heart rate in rhythm is abnormal, anything that may allude to them having another issue, we'll fax their doctor, give them the information they need.
Now, is this something where their physician refers them to y'all and then you go from there?
It is. Their physician will refer them to us. Sometimes they call us and say, I've had a heart attack, I've had a stent, I'd like to join your program. At that point, we will contact their physician and get the referral.
And so it has to be a referral-based situation. And what are some of the things that y'all do? I mean, you mentioned that you must have an EKG hooked up.
We do. We have a heart
monitor. And while
monitor.
they're doing all this stuff, are you watching them on the EKG?
The entire time. We have a registered nurse and 2 physiologists in every class. So the registered nurse or the physiologist will sit behind the monitor, watch everybody's heart, while the other physiologists rotate, making sure they're not having any chest pain, they're not feeling weak. We will get their blood pressure throughout the exercise, also get their rate of perceived exertion, that's an RPE. We like to see how hard they feel like they're working.
And that's great, because I think a lot of people are scared, after a heart attack, do I really want to go to a fitness center or to something and start doing a workout? This is a lot more medical. This is really, y'all are paying close attention, so if something happens, you're right there to intervene. Is that correct?
That is correct. And in addition to the actual physical part of it, we offer education classes that will educate them on various topics of heart disease. Some are on depression and anxiety, some are on risk factors. We have a dietitian who comes in and talks to them, so they get a well-rounded education along with their exercise training.
I have to tell you that's excellent, because actually I have a friend that's young that had a heart attack, and it is a devastating thing to the young person that has a heart attack, because they think, my life is over. I'm 50 years old and I've had a heart attack, and dealing with the issues of trying to come back from a heart attack. I'm sure you see quite a bit of that, but that is spectacular that y'all are doing something for education, because it's really needed. Do y'all set goals for these people?
We have them set their own goals when we work with them to obtain those goals. Most of their goals are just to increase their strength and their stamina. A lot of them want to just exercise safely, and they want to know what's safe for them to do at this level. So what we'll do is we meet with them one-on-one, give them the levels they're safe to exercise at. When they graduate, when they actually leave our program, they will get a book that says, this is where what you've been doing, this is where you're safe, and we address the goals then at that point. But we will along the way address their goals, see where they are, how they feel like they're doing with the goals, what do they want to improve on, have the goals changed, have you met your goals, what can we be doing more as a staff in order to help you meet those, what about you, are you exercising on your own, are you doing these things to help yourself also meet your goals.
And so some of this is that they do some of the exercise on their own.
Definitely.
How many days a week do they come to y'all?
They come to us 3 days a week for an hour. And typically the program lasts about 12 weeks, 3 months, depending on their insurance. On the days they're not with us, we like them to either go for a walk, ride a bike, something that is moderate level exercise that they can do. Our rule is they have to be able to sing, whistle, or talk while they're exercising. If they can do that, then they're safe at that level. If they're out of breath and they can't do that, then they're working way too hard and need to slow down. So we do want them to exercise on the days they don't come to us as well, because if they leave the whole weekend without exercising and they come back on Tuesday and we haven't seen them Friday, that's 3 whole days without exercise. Your heart needs more than that.
And do you find they're getting good results from this program?
Definitely. Our patients are very satisfied when they leave. They come in and they're maybe working in sets, and that means maybe 3 sets of 5 minutes or 5 sets of 3 minutes. By the time they leave, they're able to go through the whole exercise without any problems, without any rest time that they need, and they're very happy. They know they're safe to exercise. That fear, that initial fear they have to come in and exercise, is gone. They don't have that anymore.
It's great.
So it's
now,
wonderful.
what about the patient who doesn't have their surgery done necessarily at MTMC, but maybe has it done at St. Thomas or Vanderbilt? Are those people also available to be involved in your program?
Definitely. We from any hospital,
and
even out of state.
What about age? Is there a certain age that they cannot be over, cannot exceed a certain age to be involved in the program?
No, sir. Just if they have a qualifying diagnosis, one of the ones we covered earlier, doesn't matter what age they are, they are welcome.
Insurance usually, historically, will cover this?
Yes, to a certain extent. Some have co-pays, but majority of times they cover it.
Well, I have to tell you what, this is a great program, and to y'all that are out there that are suffering from these kinds of disorders, this is a program that really would be a great option for y'all. I know Andrea personally, and I know she does a great job, and it's something that I really want to encourage some of y'all that are out there to be involved in. When we come back after these messages, we're going to take a look at another program that is done by the Middle Tennessee Medical Center's Wellness Program, and that's the Pulmonary Rehab Program, or Lung Rehab. We'll see you after the messages.